Hi. I'm robo-Suzie and today I'll talk to you about cardiovascular treatment, angioplasty and stent implantation. Also don't forget to subscribe for more tips in the future. But back to our topic. It is great to live in a technology-driven world where life-saving cardiovascular techniques such as angioplasty and stent implantation are readily available. After all, there simply are times when too much plaque has accumulated over the years to be reversed through natural means, requiring more drastic action to be taken. In this article we will be looking at two of the most common procedures available to those whose love for butter, processed meats, cheese, hamburgers, and organs meats has placed them in serious cardiovascular danger required swift surgical action. Restoring blood flow through angioplasty. Oftentimes the first sign a person has a serious problem requiring cardiovascular treatment is chest pain or tightness just under the breastbone, known as angina. Generally, when angina occurs, one of the coronary arteries is at least 75% blocked, thus reducing blood and oxygen flow to the heart and producing the symptoms. While 75% is considered the minimum to produce the symptoms, it is not unusual for the blockage to be over 90%, causing your cardiologist to take swift action in the form of an angioplasty procedure to restore blood flow and eliminate the imminent risk of heart attack or stroke. If you are slated for an angioplasty, expect to spend a couple of hours in surgery. The surgery is almost always performed by a cardiologist, who makes a small incision in the patient's groin or an arm and skillfully, and hopefully gently, inserts a plastic tube, called a sheath. A hollow catheter is then inserted through the sheath into the artery. The catheter is about 1 yard long and is equipped with a balloon at its tip. As the catheter moves gradually through the artery, the cardiologist will be using a television screen to monitor his progress as the catheter approaches the arterial obstruction. Using a guide wire, the catheter is positioned so that the plaque straddles the yet to be inflated balloon. The next step is inflating the balloon so that pressure exerted forces the artery wall to widen and compresses the arterial plaque. The inflation process will likely consist of 2 inflations lasting between 30 seconds and 2 minutes. Stent implantation will likely be the next step. The current conventional medical thinking is that a stent should be implanted first and foremost to keep the artery open, and secondly because the surgeon is already there. The stent itself is a medical device that expands within the interior lining of the artery, at the side just widened by the angioplasty. If for some reason a stent is not inserted, there is good chance that re-narrowing, restenosis, will occur at some point in the future. But while all this seems fairly routine, there are risks, with perhaps the most dangerous being the possibility of the formation of blood clots on or around the stent. The good news is that most of the newer stent versions are coated with antiplatelet agents that significantly decrease the probability of clotting or smooth muscle cell proliferation. Other possible ways to reduce narrowing of the affected artery are to use slightly radioactive stents and irradiating the area around the stent. That's it. Thank you. Please subscribe, comment and like this video if it was helpful. See you soon.